I had under-eye CO2 laser 2 months ago. Now I have some puffiness as well as more visible lines. Can I expect improvement? I saw my plastic surgeon. He said that it's too early since collagen is still forming. He also said I am dehydrated. I moisturize 2 times daily. Can I expect improvement, or was this a waste of money?
Thank you for your question. You submitted your question with a single photo, and you say you underwent CO2 laser under your eyes about 2 months prior. And you're expressing a concern about seeing more visible lines and some puffiness. Your doctor states that you are dehydrated and is recommending a moisturizer. And you're basically asking, is this the case, or have you, quote, wasted your money? Well, I can certainly share with you my experience treating the under eye area. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Treating the under eye area with lasers has been present in my practice since the very beginning, starting with the original CO2 lasers, which were very aggressive and fully ablative. So I think it is important to understand some basic principles as to the effect of lasers on lines and wrinkles. And I think chances are your doctor already discussed this with you, but I think it's very important to understand this. When most people think about lasers, they often have a perception that, like in science fiction, that lasers can literally erase wrinkles. But the reality is we have to understand the types of wrinkles we are treating before we treat them. So to understand that difference, you have to remember there are two types of wrinkles we look at. We look at static wrinkles, which are the typical fine lines and crisscrossed lines that are there when the eyes are at rest. And then we have dynamic wrinkles, which are there when the eye is in motion. Now, of course, dynamic wrinkles can cause static wrinkles to occur, so which accounts for crow's feet lines and these fine lines around the eyes that radiate. Now, generally speaking, if someone has very, very deep lines, then I will often combine using a neurotoxin such as Botox to relax the eyes before doing the laser. In fact, I was featured years ago in the early days of the lasers for this idea on the news, because I basically went with this logic that I thought made intuitive sense, that if you relax the muscles that are creasing the wrinkles around the eyes, well, if you relax those muscles, when the skin heals, the collagen will model in a way so that the skin will be smoother. Now, that being said, there is still a role for neurotoxin such as Botox after the laser. The point is, I always tell my patients that even if you iron clothing, if you crease it again, you keep folding it, it'll crease. So there's a strategy there where you not only do a laser to try to resurface and remodel the skin, but you also want to prevent the skin from getting more wrinkled. Also understand that, speaking of remodeling, in terms of wound healing, there is the active phase of wound healing, which is called the proliferative phase, which lasts about a month or so. But then there's this ongoing remodeling phase, where the collagen realigns. And I've had many times patients be anxious about the presence of lines and wrinkles, particularly when I did facial resurfacing, and then noticed that as time went on, they looked better and better. So it is a test of one's patience to watch and see what happens after a treatment like this. There may be a need for more treatments, but you have to also look at what kind of improvement has occurred. Generally speaking, we try to go for whatever maximum improvement is possible with minimal downtime. And I think that, of course, is factored in, as well as how thin the skin is. The skin can only tolerate so much laser energy, and therefore you have to sometimes walk a very fine line as a practitioner on how aggressive you treat the skin. In addition, in my practice, I frequently, almost always, use platelet-rich plasma when I do lasers, because I like the way that platelet-rich plasma stimulates collagen, stimulates healthy skin through the generation of blood vessels and collagen, and basically works very well in combination with the laser to get the most results that one can hope for. You have to also think of the capacity of the skin to generate collagen. A lot of times people with very light skin who have a lot of sun damage, the under eye skin is less than 0.5 millimeter in thickness. You can only expect so much improvement. There is a strategy where, with ongoing maintenance beyond this laser treatment at one time, where you can, over the course of time, make small incremental improvements that'll help maximize the outcome. So I would say don't lose faith so quickly, but rather maintain this dialogue you have with your doctor as to ongoing strategies beyond the time frame in which your doctor feels that your results have stabilized. So I hope that was helpful. I wish you the best of luck. Thank you for your question.